The cardiovascular system. Cardiovascular system consists of the blood vessels, heart, and blood. Its main job is to bring nutrients and oxygen-rich blood to all parts of the body, and to then bring deoxygenated blood back to the lungs. Outcomes of intervention treatment for concurrent cardiocerebral infarction, a case series and meta-analysis. Number 1, the concurrent occurrence of acute ischemic stroke and acute myocardial infarction is an extremely rare emergency condition that can be lethal. Number 2, the causes, prognosis, and optimal treatment in these cases are still unclear. Number 3, they conducted the literature review and 2 additional cases at Al-Shafir Hospital. Things that they analyzed were number 1, clinical presentations, number 2, site of stroke, number 3, type of myocardial infarction, number 4, modified ranking scale, number 5, treatment options, and then they compared the mortality rate among patients with combination intervention treatments and medical treatments at the hospital and 90 days after stroke. The results of the study were that they identified 94 cases of concurrent cardiocerebral infarctions from case reports and series with a mean age of 62.5, female 36 patients, 38.3%, male 58 patients, 61.7%. There were 22.3%, that were treated with combination intervention treatments. The mortality rate at hospital discharge was 33.3%, and the mortality rate at 90 days was 49.2%. In patients with combination intervention treatment groups, the hospital mortality rate was 13.3%, and the 90-day mortality rate was 23.5% compared with the mortality rate in medical treatment. And I read about this study in the Journal of Cardiology and Cardiovascular Medicine. The conclusion to this study is, number 1, simultaneous cardiocerebral infarction prognosis is not good. And number 2, about a third of patients died before discharge and half of the patients died 90 days after stroke. And then last, even though only 1/4 of the patients being treated by combination intervention treatment, this treatment modality significantly reduces the mortality rate compared to medical treatment.